Stockholm Syndrome is a complex psychological phenomenon that has puzzled experts for decades. It refers to the tendency of hostages to develop positive feelings towards their captors, to the point of defending and identifying with them. This strange phenomenon has its roots in a crime that took place in Stockholm, Sweden, in 1973, when several bank employees were held hostage in a bank vault for 6 days. During the standoff, the victims became emotionally attached to their captors, refused assistance from government officials, and even defended their captors after they were freed. The term, Stockholm Syndrome, was coined by Nils Bogerow, a criminologist and psychiatrist who was a consultant to the police during the crime. Evolutionary psychologists believe that Stockholm Syndrome can be traced back to our hunter-gatherer ancestors. In those societies, women often faced the problem of being captured by another tribe. These women had their children killed and were put in situations where their lives were at risk. By developing a bond with the captors, they would ensure their survival. Because of the frequency of these abductions, capture bonding developed into one of the adaptive traits in the human population. The exact reason behind Stockholm Syndrome is complex, and many theories have been put forward to explain it. The FBI conducted a study of over 1,200 hostage-taking incidents and found that 92% of the hostages did not develop Stockholm Syndrome. Researchers interviewed flight attendants who had been taken hostage during airplane hijackings and concluded that 3 factors are necessary for the syndrome to develop. The crisis situation lasts for several days or longer. The hostage-takers remain in contact with the hostages, and hostage-takers show some kindness towards the hostages or at least refrain from harming them. Symptoms of Stockholm Syndrome are similar to those of post-traumatic stress disorder, PTSD, including insomnia, nightmares, general irritability, difficulty concentrating, being easily startled, feelings of unreality, inability to enjoy previously pleasurable experiences, distrust, and flashbacks. Additionally, people with Stockholm Syndrome report positive feelings towards their abuser, negative feelings towards family, friends or authorities trying to rescue them, support of abusers' reasons and behavior, and inability to engage in behavior that may assist in their release. Stockholm Syndrome is a pattern of coping with a traumatic situation rather than a diagnostic category. Most psychiatrists would use the diagnostic criteria for acute stress disorder or PTSD when evaluating a person with Stockholm Syndrome. There is no medication or drug available that can instantly cure Stockholm Syndrome. Some patients are given anti-anxiety medication or other prescriptions to help them with their nervousness and anxiety. The treatment is the same as for PTSD, with most commonly a combination of short-term sleep disturbance and psychotherapy for longer-term symptoms. Group therapy is a frequently used method, where victims can learn to deal with their emotions and form new relationships with others who have been through similar situations. The prognosis for Stockholm Syndrome is generally good, but the length of treatment needed depends on several variables, such as the nature of the hostage situation, the length of time the crisis lasted, and the individual person's general coping style and previous experiences of trauma. There are many cases of Stockholm Syndrome, but perhaps the most famous is the kidnapping of Patty Hearst in 1974. She was held by the Symbionese Liberation Army for over a year and was even sentenced to 35 years in prison in 1975 after joining them and participating in robberies. It is believed that Patty Hearst suffered from Stockholm Syndrome during her time in captivity. In conclusion, Stockholm Syndrome is a fascinating and complicated psychological phenomenon that can occur in anyone who has experienced a traumatic event. Although the exact reasons behind it are not fully understood, it is treatable with the right combination of medication and therapy.